Hello, it's Alan. Time for a top surgery update. It is March 2015, and I'm about 7 months post-op, approximately. So let me see if I can make this a concise video. Here is what my chest looks like. Gotta move my chair. Side view. Apparently I can't talk at the same time that I move. So, I am really happy that I have this chest. I'm really happy that I got the surgery. I mean, like, so happy. It feels completely right. I mean, I have no regrets. It just feels so much more better. So much better than its previous manifestation. Yeah. Oh yeah, I should give you the background information that I had my surgery August 5th, 2014 with both Dr. Crane and Dr. Satterwhite in California. They did a great job. As I said before, I love the layout, the placement. The lines are definitely at the right spot because I've been, doing chest work, and you can kind of see. Can you tell that the incisions are at the muscle line, which is awesome. So I guess the main thing to update is the scars because I had said in my previous chest update video that Dr. Crane told me that I had keloid scarring, like the big fat raised scars. So I've done some stuff for that since then. One thing that I've been doing, well, I should tell you the biggest thing first, which is which is that about 2 months ago, I went to see Dr. Satterwhite and he did steroid injections into the incision scar. Not into the nipples. He said, like, he's not going to do that anytime soon. Like, don't mess with the nipples, basically. But he did, like, a series of little injections, like that, like a bunch of them, into each incision line. And that was really horrible. That was excruciatingly painful. It was definitely more painful than I'd been expecting. Yeah, it was bad. Kind of like you might imagine it would feel to have injections into a tender, delicate scar. It took a few minutes, and I was like laying on the table, like gripping my side of my pants, and like I had to close my eyes. And I tried to breathe, but I still felt really lightheaded afterward, just from the pain. Kind of dizzy. I felt like I couldn't even drive right away. I had to just like sit in my car and close my eyes for like 20 minutes before I drove. So, I'm really glad that those injections did have a significant effect because I could potentially choose to go back for a second or even a third round, but since they did have an effect, I'm like, no, no more injections there. So what the injections did was it made the incision lines quite a bit flatter, actually. It did not reduce redness, but it did make them flatter. Like, sometimes if I touch it, like, it's really hard to tell where exactly the scar begins and ends, because it's pretty flat in some spots, so that's awesome. Like, the lines don't really show through my t-shirt in the way that they did before, so that's good. Um, so Dr. Satterwhite told me that they have some sort of laser machines there that I could get laser treatment with at 1 year post-op that could potentially reduce redness. So I might consider that. And it sounds like there would be no charge. There is no charge for the steroid injections. It's like they do these things for free, or it's like it's included in the surgery price, which is really nice, and I'm thankful for that. Yeah, I guess I can, at this point, show you a close-up. Now, the purple that's kind of in the middle of the line there is a product of the steroid injections. It was sort of like a blood blister or bruise type of thing in the middle of that line where he did the injections. And that has not totally gone away, which is weird because it's been 2 months since I had the injections. I'm not a professional, so it's hard to get the lighting good. But hopefully you can see that, yeah, the scar still sticks out some, but it's flatter than it was before. It did make the scar a little bit wider in some places, like here, but I was warned that that could happen, and I guess I'd rather have it wide than, like, making a bump in my shirt. And you can see the nipples, which were not treated with the injections. This is the better one. It's somewhat flat around the edges, which is good, although it has not yet gotten the actual nipple part to stick back out, which I'm really bummed about. I'm hoping that it'll look more like a normal nipple as time goes on. We'll see. And then this is the one that's not as good. It's more raised. It's more of just a big bump. Not thrilled about that. It's pretty disheartening. But, of course, it could be worse. What else? Well, I guess that's enough of a close-up. So another thing I've been treating the scars with, both the nipple areas and the incision lines, is something that I should actually have with me to show you. So I forgot about that. Hold on for a second. It is this ScarAway, which was recommended to me by the YouTuber Dade. Scar Repair Gel 100% silicone. And it's hard to tell if it's made a really huge difference or not because I have nothing to compare it to because I'm doing it on both sides. But I do feel like it has made the scars softer, you know, like less tough, sort of more pliable, which is a positive thing. And I have this vague feeling that it might be helping, which is why I continue to use it, but that's about as much as I can say. And, oh yeah, some spots on the incision line are getting a little bit less red. I mean, this may not mean that much to you because it's really subtle, but, like, where is it? Like, around there? This is very bad lighting. Well, there are a couple little spots in here where maybe you can see that the lines are getting a little bit less red, so I guess it's going in an okay direction. So yeah, I'm just really disheartened that the nipples don't look more normal, but I know that things could continue to change still in the next few months, possibly, so I'm trying to be patient, and even if it doesn't change, I'm still much happier with this than what I had before, you know, before surgery, so it's not too bad. And I could say a word about sensation, although it's actually really no different than the sensation that I mentioned in my previous video. Well, actually, what do you know? I can feel that. Huh. Maybe it is a little different. I hadn't experimented with that, really. I can't really feel a very light touch on my nipples. You know, I can actually kind of feel that, I think. Huh. I can't feel that. I can definitely feel that. Well, I think that might be an improvement. That's pretty cool. And I still have this very weird, slightly, like, partially numb area over here, which is near the line on my back, which is a scar from the chafing of part of the surgery binder. So I don't know if the binder, like, kind of killed some nerves over here or what. Or if that's a product of stuff that they did in here. I don't know, but it's weird. Anyway, let me know if you have more questions. I think that about covers it. Thank you for watching. Bye.